Yeah, welcome everybody to our panel on how to become a psychedelic therapist. My name is Felicitas Vallot. I am program manager of the Augmented Psychotherapy Training of the Mind Foundation, together with Max Wolff, who is the head of psychotherapy training and research at the Mind Foundation. We have invited 7 participants of the training to explore the journey of how to become a psychedelic therapist. All the participants are from different groups, from different courses of the training. And yeah, I guess to start with, I would just love to introduce yourself briefly. And maybe start here.
Hey, I'm Ville Salmensuu from Finland. Background, I'm an emergency physician, also got somehow into psychology, so studying that as well.
My name is Cara Regan. I am a trauma therapist from Winnipeg, Canada, integrating somatic therapy into my work as well. So,
yeah. I'm Juan Paris. I'm Venezuelan of origin, and I work as a psychiatrist in Spain, in Barcelona. I'm a general adult psychiatrist and also a psychiatrist for children and adolescents. And yeah, now I'm trading the field of psychedelic therapy.
I'm Philipp Grimm, living in Düsseldorf. Right now I'm finishing my master's studies in psychology, mainly clinical psychology and psychotherapy. I got trained in transpersonal psychology and psychotherapy, Rogerian talk therapy. And I'm also a facilitator of the Mind Foundation's Beyond Experience program.
Hi, my name is Maja Kutsandrio. I'm a psychologist and psychotherapist located in the German city of Leipzig, working in my private practice, and I'm currently in the 2nd year of the German APT course, and yeah, just started to also do ketamine sessions in my practice with my colleague and friend, a medical doctor.
Hello, my name's Laura. I'm from Canada as well as Cara. I am a clinical psychologist, EMDR therapist, hypnotherapist, and now psychedelic therapist. Yes, I've worked in ketamine clinics at home. I've started a ketamine clinic, and the journey's pretty amazing.
Hello, everyone. My name is Tomasz Wieczorek. I'm from Wrocław in Poland. I am a psychiatrist and a researcher and an academic teacher, and I'm a psychotherapist in training. I work also clinically with psychiatric patients, and I work also in the field of sleep medicine a lot, and I do research also in the field of sleep medicine and different neurostimulation methods like deep brain stimulation and transcranial magnetic stimulation.
Yeah, my name is Max Wolff. I'm the head of psychotherapy training and research at Mind. I'm a psychologist and a psychotherapist. And yeah, together with some colleagues from Mind and also actually quite a lot of external collaborators, we started developing the APT program, I think 3 years ago, more or less. And since 2 years, we're actually doing the training. We have a few people from the first cohort here, which is a great honor, really to, I wanted to start also by thanking you for trusting us with something we've never done before. So thank you for that. Yeah, maybe I should say a few sentences about the APT program. Very briefly, it's a professional training for mental health professionals who want to incorporate psychedelics or psychedelic working with psychedelic experiences in their clinical work. It's an on-site training in Berlin, but it's also an online training. So people come here for several intensive weeks over the course of the training. And between those intensive weeks, there's an ongoing online curriculum. So there's regular exchange. It's probably also important to say that it's an international training. There's an English language APT course that starts every year in November, and there's a German language APT course that starts every year in March. I think that's probably enough from me at this point. I think we will tell you more about the program over the course of this discussion.
Thank you. So we'll start with the first question, where we like to explore what, in your opinion, makes a good therapist, a good psychedelic therapist, and what would you say are the skills and the knowledge that a psychedelic therapist should have? And if there are any, do you think the APT program helps you in any of that?
Okay, I'll start. I think to start with, it is the psychedelic world or the psychedelic field, or whatever you want to call it, is an incredibly different state. And so I personally believe that therapists should have their own practice with using psychedelics. I don't think you can be a psychedelic assisted therapist without also having your own personal experience. And I also think because the altered state creates such a vulnerability, then the therapist has to be extremely grounded in their own sense of self and have a really, really good awareness with transference, countertransference, much more so than just regular therapy when you're just dealing with the consciousness.
Yeah, I can continue. So I agree, and I think this question has been there during these days, been said in different ways. But yeah, it's the presence, being able to really witness the patient's process and having your own kind of shit together, or at least well on the way, so you know when to interact, when not, and also the experience about the psychedelic state, altered state. To me, what the app program showed me that this, I had some experience with meditative states, but especially the breathwork experience. It was my first, and it was really profound. That I understood that, yeah, you don't have to take any substance to experience that and to be a good therapist.
I would actually break it down to empathy, compassion, and mindfulness, which may sound rather simple, but I think it's actually not. I think it's not always that simple to be present when you have a patient who experiences very intense emotions, and not panic yourself, but stay grounded and be present and not react out of fear and out of your own needs, but to be fully there for the person and holding space.
I would also add the value and the importance of humility, because as much as you learn, and the more you learn, the more you realize you don't know anything, or was Andrea's first talk, the Dunning-Kruger intersection with imposter syndrome. But part of humility means knowing your limits and knowing when to ask for help. And that's where I think having a professional network of colleagues and peers that you can consult with, that you can turn to, that you can actually work together with, whether it be inducing an altered state or throughout the preparation and integration process, that all of those things are so, so valuable, and that you can't really be taught humility in university or in a course per se, but you actually learn it from each other. And that's one thing I found really valuable, is having such a diverse group of folks, not just internationally, but personal identities and professional trainings, that it's very humbling, and it, I think, has helped me be just a better therapist, not even just a good psychedelic therapist. So.
Yeah, I would also echo what you just last said. I think you have to be a good psychotherapist to be a good psychedelic therapist, or a good therapist overall. And I put a lot of value on trying to stay very much anchored into solid traditions, and to safe connection with peers, with mentors, with supervisors that allow you to keep checks and balances into your practice and to your own personal needs. So yeah.
Yeah, thank you. I'm curious maybe to answer a question to you, Juan. Do you maybe want to say a little bit about the mentoring or the supervision of the mentoring groups? Like maybe tell more about that?
Yeah, so we've been connected with a group of mentors / supervisors. In my previous work, I would have recognized them as supervisors. That have all been people who have taught us throughout the course in different ways and means, through lectures or through some of the sessions that we've had. And it's been quite helpful, especially for those who have not had a psychedelic practice at all, because you've also been able to connect with things that you haven't been absolutely in touch with, but also, I don't know, you feel like you've had someone holding your hand through your first steps, and just, I mean, you're going through a whole postgraduate studies, but at the same time, you're taking very much baby steps into a field that's growing, and that can feel overwhelming when you realize that you really do not know anything at all from everything that's out there. And so having people who have an important background, who have experience, who've gone through the process, and also joining all that in a group of peers who also have various backgrounds and degrees of experience, I think helps you, like I said before, helps you anchor you down, both when you have massive doubts around things, but also when you feel like you know a lot of things, or that you're very clear about how to go about things, and they just bring you down and anchor you back down to the ground. So yeah, and it also provides routine stability, because we meet monthly, the same group of people, so a group dynamic and a group intelligence creates. And I think that's very valuable. Yeah, supervision is, I think, part of the key.
Yeah, I agree. Thank you so much for saying a bit more about that. And
Thomas is here. Thomas wanted to say something.
Yeah, I wanted to add something. I think psychedelic therapies are comparing to, let's say, normal psychiatric work and normal psychotherapy, especially if you are new in the field, you often require more teamwork comparing to psychiatry and psychotherapy. And it is very important. I think this teamwork, for me, it's like on 3 different layers. One is mentoring, great, and it's provided in the APT program. So, and it's very helpful, because I can get in touch with someone who is much more experienced within this field. The second thing is the group of peers. We are really, it gives an opportunity for an intervision, for support, for consultations. And for me, as I'm not from Germany, it's also very important to have a local network of people in my city, in my country, that I know that work also in this field. Maybe they sometimes specialize in some aspects better than me. It's also very important. Yeah. So I think these 3 different domains of support are really, really significant.
thank you, Thomas. Yeah, so talking maybe more about steps of how to become a psychotherapist next to the training. I'd love to hear a bit more about where or how far advanced are you in building your own practice as a psychedelic therapist, and especially like considering legal frameworks, where do you see or where have you seen challenges, and where are you in overcoming them? What are your plans?
So I think first it's important to be really well rooted in your field before you do psychedelic work, to have a really strong foundation, and not to do anything you wouldn't do with psychedelics, you wouldn't do without psychedelics. Put it this way. For me, I just started to work with ketamine in my own private practice a few months ago. So it's like I'm walking baby steps right now, having done just like a few sessions with patients. And in Germany, it's quite complicated because there are many legal constraints. Yet we can work with ketamine as an off-label use. So there's the issue of reimbursement with the public health system, which is not yet possible. So we can offer ketamine therapies and then to private patients, which is also not so really sure yet if private health insurance is covering it, or to people who are able to pay this by themselves, which is of course quite cost intensive. So we are addressing these really like basic questions, and we're just learning things on the way. So it's like learning by doing very much. And the question of the network was mentioned several times. I think this is really important. I was so lucky to find someone in our app group, which I'm working with right now, and it works out really well. But I think the question of local networks is also very important, because now we don't have so many therapists in Germany doing it right now. And so my colleague is from Munich and is traveling really long ways to do this together with me. And it's like we're just developing this kind of work together. And
Thank you, Maya, for the valuable insight. I think it's very important for people to really get an idea of how to find your way into this kind of practice. I wanted to ask a follow-up on one small detail that you said. I'd like you to explain a bit more. You said, or you gave you said that you shouldn't do anything with psychedelics that you wouldn't do without psychedelics. Can you elaborate a bit on what you mean by that?
I mean, psychedelic therapy is psychotherapy basically. So I always hear of people in the field who have never done psychotherapy by themselves and want to start as maybe psychedelic practitioners. And I see that as a problem sometimes, because in my opinion, you have to know the basic stuff to work with these very vulnerable and receptive states. Because if you do bad therapy in psychedelic therapy, it can probably be much more harmful, and there have to be several issues addressed, like abuse of power and stuff like this. Yeah.
Maybe this also refers to groups of patients or indications, diagnoses. You should work with, when you're not comfortable working with PTSD patients, yes. You should not think that psychedelics will compensate your incompetence in that regard. Yeah.
No. It will shed light on your incompetence then. So because you have a whole space in a very complicated situation, and it's whoever has done regular psychotherapy with complex cases with complex patients knows how difficult it is, and it doesn't get easier when you add psychedelics to that. So
in one of the sessions today, I think it was the one about art in altered states. Someone asked how many psychedelics, it was something like this, not exactly, but how much psychedelics could substitute the actual ability to draw. And of course, the answer was that there's no amount of psychedelics that will make you be a good artist or drawer. You might do interesting things whilst on psychedelics, but it's not necessarily that you're a good artist. And I would echo that too, yeah. Since there's not enough amount of psychedelics that you can take that can make you a good psychedelic psychotherapist. But I guess there's enough training that you can do to, yeah, prepare you for this. And I was just very excited the first time that I saw in my regular practice that I was including some of the concepts and the strategies and even the stance and the attitude that we've been discussing in the course, but just in my regular practice, far away from my first baby steps in psychedelic things, just in a regular psychiatric practice, some general change mechanisms there.
I promised not to say that word in this panel anymore. Thank you, Juan. I think it's actually really important for people to hear more stories of how you find your path, what challenges, what strategies did you adopt?
Yeah, I can speak to that. To be clear, I'm not a psychotherapist, so after this app training, I will not be a certified psychedelic therapist, but a co-therapist. And so I've been like dancing this to go into just start doing something versus like being careful about what my capabilities are. And I think the app framework is useful. And I learned a lot about psychotherapy, the GCM, general change mechanisms. And yeah, so I did some a mentor, I just suggested that just start doing stuff. I did some integration coaching, and also what now it seems to come together with the ketamine experience we had as part of the course. I realized that while I'm giving ketamine to my patients at work anyway, and so we are now looking into creating a clinic in my country where I could be facilitating this process. And there are even more hurdles than in Germany. But yeah, it seems to come together. And also, I feel very lucky that I was handed an opportunity, much thanks to the apt training, to do work, a separate project in a legal context. I'm just so grateful.
Meanwhile, in Canada, things are complicated. I think one thing to be mindful of if you're wanting to train to become a psychedelic therapist is, number one, it helps to be a therapist, because so much, as we've learned, of this work is psychotherapy. And so whatever methodology you want to train in, you're drawn to, whatever education that you might need in your respective space, I think it's good to invest good energy there as your foundation, because that's what you're going to build off of. I would say once I became more confident as a trauma therapist and got my certification in EMDR and felt more competent to be able to work with folks in experiencing complex challenges with their mental health, that helped aid me in thinking, okay, maybe I'm ready to also layer on the possibility of supporting folks in an altered state with these complex challenges that they're experiencing. So practically speaking, it also takes a fair bit of courage, because you're doing you're gonna feel like you don't know what you're doing all the time, which I think is universal to everyone in this room, honestly. So yeah, in Canada, it's interesting because right now, theoretically, it's legal to use psilocybin and MDMA, as well as ketamine for off-label use, through something called our Special Access Program. However, that's approved on a case-by-case basis, and the only person who can submit an application is a medical doctor or a psychiatrist, which I am neither, which means one of the challenges is I, as a meager therapist, need to somehow make friends with or network with medical professionals in my local space. And so I think, again, that comes back to having a really good foundation, training, natural networking that you're going to do, getting to know people in the city that you live in or the country that you live in, getting really good at some kind of therapy. And by good, you feel competent, and other people have said, yeah, you're pretty good at this. Ideally, just not making things worse for people. Which you can't always guarantee, actually. So yeah, courage, having a good network, having a good foundation. I myself personally have just made a bit of a transition out of working in like a public not-for-profit space, just doing counseling and psychotherapy, to now being fully self-employed and integrating psychedelic therapy into my private practice. Not yet with inducing with pharmacologically speaking, but you can learn to work with breath work. You can learn to work with altered states more broadly. That's one of the things that's nice about this program, is it's not just learning how to work with psilocybin or just learning how to work with MDMA, but more generally. So yeah, those are some of my thoughts.
The more I learn about this, the less I know. And 3 years ago, when I started this, I was, oh, I got this. It's not so hard. And now I realize how little I know. So the other thing you want to bring into this is a really big sense of curiosity, because I think more than even the other modalities, especially what's happening in the field and how much more research is happening and all the new information coming out, and how are we going to do this? I mean, this conference showed you, like, it blew my mind, my brain cells hurt. But it's a sense of curiosity to keep learning, and that you don't just become the therapist, but you're constantly seeking out more people to learn from, and the interaction between you and other people. I mean, that's why I love the APT program so much, is it was European viewpoint, and it was a viewpoint from not just therapists, from medical people, anesthesiologists, emergency physicians, and we didn't get that training. There's not that training in Canada. So yeah, you have to have a big sense of curiosity, and you have to really, really like be into this stuff, because it's, yeah, it can pull you sideways.
Can you elaborate a bit on the difference between the European and the American or Canadian?
Well, so Cara and I are both from Canada, and there's 2 provinces in our country. So we are one country, but 10 fiefdoms. All the provinces have their own little power dynamic going on, and 2 provinces have decriminalized certain psychedelics, but it's still not legal. Cannabis is legal, but you can use, in BC, for example, the province on the west coast by the sea, you can use certain psychedelics, but a very low dose, and that's the decriminalization of it. But each province is sort of regulating themselves. So it's a quagmire, like moving province to province is like moving country to country. And it was very interesting because I sit on we have a Psychedelic Association of Canada, and I sit on the research team. And Pam Krakow, Dr. Pam Krakow, she's a physician in BC, and she just put out this piece saying, this isn't going to be legal for 15 years because we can't get along. Like, we can't figure out how to work together. Everyone's got their own private interests, and we're not organized. And so that's the downfall that is probably in my country, in our country, probably 10, 15 years.
Maybe less.
To be used in a therapy setting.
Thank you, Laura. I think this gives us also an idea of how people really need a bit of a pioneering spirit in order to decide to take all the time and money and effort to go on this career path at this point.
Yeah, I feel like we have already touched a little bit upon what advice would you give to other people? So I'm not sure if you want to say a little bit more about that. Any of those who haven't spoken on that?
Yeah, I
question?
think one of the advices would be just be curious and follow what you feel inside. If you feel like you want to do it, you may just try to make first steps with some integration, or maybe you just have some patients within your practice who have some psychedelic experiences, and you just are open. You want to talk to them about it, and then you want to try to integrate it. I think it's also important that being a psychedelic therapist, it's not only about psychedelic assisted therapies, but also about integration, which is practically legal in most countries. Yeah. So this is something that it's easy to start with. And the second thing is that there is always a perspective of using non-pharmacological ASCs, yeah, like breath work, like we are learning in the APT. It's also important, I think, to remember about that. There are other ways how we can work with patients, and yeah, these would be my advice: is to stay curious and follow what you feel, how you feel about it, about working in this field, and maybe integration is the first step you can start with.
Yeah, we should also say probably that the whole first part of the APT program focuses on integration. Yeah. In the first intensive week, we do not do any self-experience with ketamine, which we do later in the program. The first part really focuses on really learning how to integrate before starting to induce altered states.
I think we can regard psychedelic therapy as a form of intensified psychotherapy process. And that means that the processes you will deal with as a therapist will in general be much more intense than also in frequency. Like in general psychotherapy, you will have like the odd intense session with patients and deal with existential themes, issues. But I think in psychedelic assisted therapy, you will have that much more often, much more frequently. And also as a therapist, I think you should, to some extent, go through a similar process yourself, just in order to be aware of your countertransference issues. And I think you should ask yourself, are you willing to do your own process, and also are you willing to deal with in such intensity in your therapy sessions with clients?
So Philip, maybe to follow up on that, what would you say is a healthy and professional dose of working yourself with altered states of consciousness?
It's a tough question. I'm not sure if I can get an absolute answer for that, because it's I think it pretty much depends on where you are in your process and how much you've processed already. I think one good indication may be if you if you're hunting for self-experience and at the same time are neglecting other areas of your life and other values that are important to you, then you're probably heading into the wrong direction. But on the other hand, for example, I've got to know a few people in my transpersonal training, which can very easily access kind of psychedelic states and navigate through them without ever have taken a psychedelic substance. They I think in a way they have an advantage in integration because they're not dependent, so to say, on the substance, and which is one of the reasons why I like the fact that we focus so much on integration in our first year.
I'd be curious to hear more thoughts from the group on maybe more generally on the self-experience aspect in the APT program. What have your experiences been, or maybe also on a more bird's eye level? How would you describe it? What do we do with self-experience in APT?
Well, one memory from the course just appeared in my mind. I will share it. It was when we were working in groups after our breathwork experience, which first of all I have to say that it was first time when I had a breathwork experience in my life. So it was in the APT course, and it just blew my mind. It was, I never expected it. It's so intense. It can be so intense. Later, when we were working and trying to integrate our experiences, I had a discussion with a colleague from my group. Her background is mostly psychoanalytic. My background is a bit more psychodynamic still. We discussed that our, let's say, approaches, psychoanalysis, psychodynamics, do not guarantee us all the tools to work with this fast pace, with what happens very fast in the psychedelic state and after the state. So sometimes it is important to integrate something fast, and well, we know that psychoanalysis is not very fast. So sometimes we just may lack some tools. So self-experience was also very important for me to really notice that we might need different tools. Of course, there are many different tools in integrations. We also need some theory to use it in this context. Yeah, these are these three magical words that Max loves so much. So yeah.
Yeah, I feel like the self-experience has been very well braided into the overall process. So it doesn't just serve the purpose of us connecting with self-experience and experiencing tools that we haven't used before for ASCs, but also to make sense of the overall process, like how to really properly prepare someone and accompany someone through the process and then start integrating. So it served almost more as a self-experience to the overall process of preparation, accompanying or sitting or joining someone in their journey, and then starting to integrate. So yeah, I think that's the most potent part of the self-experience in the program. And in that sense, and connecting with what you said, Philip, I think the amount of self-experience that you do in your own life makes sense as much as you braid it into your overall course of your life and your growth. And we're talking about personal growth and professional growth, as much as you make it have sense and in a specific direction in your professional growth. So maybe not about the quantity, but about the quality and the value that each and one of the self-experiences that you do or the explorations that you do have.
And I like the how the self-experience parts really deepen the group process we have been having. It's now at the end of the 2 years almost, and lots of memories and how we started with working with dyads, with breathwork, and stroboscopic like before that, and progressed into ketamine with triads. First the preparation, then we were all together in the session, and then the integration. There are 3 people, 2 therapists working as a team, and then 1 could be observer. But was really like staging toward the like therapeutic process. So yeah, starting to feel more and more ready.
Yeah, thank you so much. We are getting to the close of this first part of the discussion and have 15 minutes left for question from the audience. I see there's already one. We're just getting the microphone to you.
Thank you. I'm curious about how you address in the training that I believe that therapists who work with psychedelics need to have a very expanded worldview. In my own experience, I have worked with people who have past life experiences, future experiences, or no experience for hours, and dealing with, how do you manage that? But mainly about the worldview that needs to change. And how do you prepare for that in the training?
I think this training is not the training where you get like this one model that tries to explain all the varieties of psychedelic experiences you have, and in detail tells you this is good because of that. It rather in a training, I think the training rather encourages you to have a certain tolerance for uncertainty, and I think this is really important because you will deal with experiences that may seem weird or hard to explain, sometimes even hard to talk about, and I think to some degree we have to respect the fact that we won't know the answers. I'm not saying it's not we shouldn't strive for answers, but we have to accept that we don't know everything, that we actually know very little. And I think it's rather about meaning making and supporting the patients to explore and make their own meaning out of their experience, rather than to search for sort of objective truth in their experience.
I just quickly wanted to share also something because I'm also part of the training. Thank you all so much for being down there, and I think you showed really well what it is about. I wanted to emphasize two things because in the talk that Andrea gave just previously, there was something, or she talked about compassion fatigue, and I think the self-experience in the training is also very much needed to build resilience in your professional surroundings and to be able to find your own way in how to do this work and stay safe and healthy on the way. And the other thing is I find it really inspiring how this is the only training that I know of that depends so much on different professions. It's very essential that you have a multi-professional team because a psychotherapist won't know how to administer an IV of ketamine, and the anesthesiologist won't know how to do EMDR, but both is really like you need to have different disciplines. And I think in the psychedelic space, you need to work together as a team differently than what I've experienced from other psychotherapeutic contexts. And you really need to trust the people that you work with, and you really need to know each other And I think that's something that has really changed for me in the APT course, because I didn't, or I approached it differently, how I open up also to my professional peers, because you really need to know how you work in these vulnerable spaces.
I would also say that at least for the first cohort, I think the faculty was very brave in their selection, because we're a fair, not spacey, but we're a very varied group. There's a lot of backgrounds, which I think it spans the worldview, which I think was more or less the part of the idea of your question. So during the training, we're already challenged by our own peers on how to see things. And the faculty does the job of maybe trying to ground us back down into what their perspective in general is, which is very much in line with what Philip said. But there are different worldviews within the students that are always pushing and pulling things in different directions, and I think it spanned the way we have to look at things. Yeah.
Thank you. And another question from the online audience, and that's about, does the program have any theoretical knowledge in order to address philosophical and metaphysical or spiritual questions which might frequently arise during such experiences, and which could be connected with the therapeutic outcome?
Well, we've been trying our best. But I would say probably the group is better able to answer that question. And feel free to speak what was missing in the program if you feel like that.
I think the whole idea of the program is in line with what David Yaden said today as the final remark during the spirituality talk, that we really need high ethical standards, and we need a professional language and professional attitude. So we have to be really respectful for patients' worldviews, first of all, not our worldviews, which we shouldn't in any way impose on the patients when they are in these extremely susceptible states. So this is first of all important. So I think in these terms, this is important to follow the patient and really be mindful about our own worldviews. It's perfectly okay, but we have to follow the patient and help the patient to get some form of meaning in all of this experience.
Yeah, and I think part of, to speak to that question a little bit that came from online, the whole emphasis of that first year, at least of our cohort, was on integration. So meeting a person where they're at with whatever they're bringing from their experience, be it existential, philosophical, spiritual, practical, something that they are looking to digest and understand more deeply. And so you learn a whole lot of tools on how to work with a person to integrate, both through the program itself, but also through the footsteps and the beyond experience, which are also prerequisites and part of the program that you yourself have to undergo. And through that, you learn different meditations, you learn different exercises. There's the whole beyond experience. You should do it. It's really good. Like objectively, I was in Portugal, so it was a great time. But yeah, you learn a lot. You walk away, or I walk away feeling actually trained in how to do this, not just theoretically, not just reading papers, not just, having conversations, but actually the applied practical experience of working with people in an altered state and helping prepare them for that, go through it and integrate it. And you really get that full preparation and really good grounded training. So yeah.
I think this training has taught me less is more. And this training taught you patience It made you realize that you're biased, that you have to, that the client or the patient, they have the answers inside, and that you have to trust that, like especially in an altered state, it doesn't have to be pharmacology, it can be breath or dance or anything, but what they need to know in that moment, it will come up for them. And for me, this training, especially the in-person learning, like the experiential learning, taught me to get out of the way. Just get out of the way. Everything will reveal itself to the client or patient. You just have to have confidence in your ability to hold space and safety for them. And that's what the in-person learning did. Is I remember in one of the breath works, Hans, he came up to me and he goes, "Why do you keep moving so much?" Like, oh, ADHD, I don't know. And he's like, "You just be still, you don't have to move so much." And that's when I realized I don't have to do anything. I'm with this person as their therapist, but I don't have to do anything. It will all be revealed, and that's what this training, but the training teaches you that over 2 years. You don't learn it in 1 week, even the second week, but you do one intensive week, you leave, and then you have this couple of months of processing and just going, oh my God, what was that? And then you come back again and then you do it again, you're like, okay, wow, that was even more intense. And I think that's the beauty of this program, is it's spaced out enough so that you get enough time to have all the information processed and filter organically without you memorizing for an exam that Max has decided we don't have to take, right?
Yeah, what I'd also like to add is in the training, there's also an emphasis put on building awareness, an awareness of how to use language, an awareness of like what are the connotations of certain words that are being used. What does it mean if we use certain words to describe psychedelic experiences? Or building an awareness about how to create the setting. How are we influencing the person's experience through the setting? Are we putting out religious imagery or are we not? Are we putting out natural imagery or not? And yeah, really, rather than like saying exactly what we should say or how it should be said, more like really like building the awareness of what it creates if we use language, setting, music. We talk a lot about the music as well. So maybe 1 or 2 last questions. There are 2 here. And there actually has been one on top there, which I'd love to take.
Thank you for your presentation. It's certainly brought all of this together. You remind me of the people who originally became psychiatrists. They had to go to be analyzed for many years before they were allowed to be psychiatrists. And it seems to me you're reflecting that. I just wondered whether if the word acceptance has to be part of what you're learning to do, and you have to be very cautious about being judgmental in what you do. And I'm just wondering, I'm the person who went to the 18,000 attendance in Denver of the Psychedelic conference. And I met so many people there who said they were doing psychoanalytic therapy. And I was very frightened by the fact that I couldn't get anything out of them as to what they were doing. And this is very impressive what you're doing. I just wondered, in therapy in the United States, so much of it is evidence-based, manualized, and people are taught to do this, and the goal is to change behavior. And your goal is not to change behavior. Your goal is to go along with the behavior that's changing. And I wondered if you could talk about that. And does that mean that you have to be much more aware of the unconscious mind, of unconscious, what the unconscious is bringing up, which I don't think is taught in the United States in a clinical setting?
That's a very good question. Do you know Paul Conti?
Who?
Dr. Paul Conti. He's a psychiatrist in the US. Anyway, he has this idea that we have 90% of our behavior and our beliefs is subconscious and 10% is conscious. But he calls it the cupboards of your mind. He calls it we have 10 cupboards of our mind. And he feels the role of any psychoanalysis or any work psychologically is to learn about what's inside those 10 cupboards and then to understand what's inside those 10 cupboards. Because once you can do that, then you don't get problematic behavior or addictions or other issues because you don't know where they come from. And so one of the ways he has said that you can unlock these 10 cupboards of your mind is with psychedelics. And so...
How do you spell his name?
Paul Conti, Paul Conti. Yeah. I can't remember the university he's at, but I loved that analogy because this is another thing about being the therapist. It's not for you to analyze. It's not for you to interpret. It's for you to create safe enough space, non-judgmental, so that they are free to go and open these cupboards and that they can turn and face the tiger and have the courage because they're not alone in doing it. And then it's understanding yourself, know thyself. And that's, I love the psychedelics because it's a relationship between the plant and the client or the patient. You're not involved as a therapist. You're just there to create a container so that they can go through it and understand it.
I'd like to add another aspect to that. I think sometimes in psychedelic therapy, it's even about letting go of trying to understand what's happening. In the role of the therapist as well as the role of the patient. In the role of the therapist, I think the manuals are actually more about what not to do and how to be very minimal in your interventions. And yeah, as a patient, I think it's much more about feeling and perhaps also embodiment, yeah, but to let the process unfold itself, not trying to control it, and which also means not trying to understand everything that's happening.
Maybe a final remark from Max.
I don't want to do the final remark of the panel.
I'll do the final remark.
I wanted to say something about manualization, but I think we can leave that for the next Insight conference. So we need manualization in some parts of this treatment. Some things are be gone through, right? There are certain things that I should not forget when preparing a patient for the first time for a psychedelic experience, for instance. But there are also things that are more like attitudes, overarching attitudes, or things in the context that you should keep in mind all the time. That's maybe you can call that manualization because it's written down somewhere, but it's not a fixed procedure or anything. And then there's theoretical models, right, that tell you how to respond to specific kinds of states or situations. I wouldn't call that also a manualized treatment, but that's rather a flexible, the empowerment to be flexible, but at the same time grounded and oriented, not doing random things or not just letting the thing happen as it unfolds, but really being process directive. Microphone is off. Now it's on. The last part was not important. Phil, you want to say something?
Yeah, I think I'd just like to close the round. It's 6:30. We had a long day. I'd like to thank you, as well as the audience, for coming together to explore this new emerging field of therapy. If you have any further questions, please just come to us to discuss more. Yeah, and I wish you all a good evening.